Uganda's black market pharmacy, where expired drugs fuel a street economy. In Uganda, even expired drugs have resale value, if you know who to ask. Welcome to Weird Geo Economy, the channel where we dive into the world's strangest, darkest, and most unexpected economic systems. Today we're heading to Uganda, not for its wildlife or coffee, but to uncover a pharmaceutical black market where even expired medication gets a second life and a price tag. We're on the ground in Kampala, Uganda's capital. But this story spreads far beyond the city. Across rural clinics, roadside markets and urban slums, there exists an underground network that runs parallel to the country's official healthcare system. It's not hidden in back alleys. It's often right out in the open. On wooden stalls, in plastic tubs, and in the pockets of street vendors, you'll find pills, syrups, and capsules, many of them expired, unlabeled, or stolen straight from public hospitals. Here, medicine is both a necessity and a currency, and expired stock is just part of doing business. Uganda's black market for expired drugs is booming. Here's how it works. Medications, often donated by NGOs or purchased with state funding, arrive at public hospitals and clinics. Due to lack of oversight, corruption, and weak inventory systems, many of these drugs are either mismanaged, expire unused, or are stolen before they're dispensed. Rather than being destroyed or returned, they're resold by hospital staff, middlemen, or informal vendors who know how to tweak expiration labels, repackage pills, and pass them off as fresh. These drugs are then distributed through informal markets across the country, especially in underserved areas where pharmacies are scarce and people can't afford official prescriptions. And because many Ugandans can't access basic care, they turn to street sellers for antibiotics, painkillers, malaria medication, and even HIV drugs, no questions asked. Because Uganda's healthcare system is overwhelmed, underfunded, and stretched beyond capacity. With limited government resources, staff shortages, and rural populations often cut off from formal care, people rely on whatever is available, even if it's expired. Plus, most Ugandans pay out of pocket for medicine. If a public clinic runs out, or a patient is too far away to reach one, they turn to the next best thing: informal sellers. Add to that widespread poverty, a lack of health education, a near-total absence of pharmaceutical regulation, and you get an environment where expired drugs aren't waste, they're inventory. And for some sellers, they're extremely profitable. Many earn more on the black market than they would working legally, and some operate like micro-pharmacies, offering bundle deals or medical advice based entirely on rumor and recycled packaging. The ecosystem includes hospital insiders who divert expired or unused stock to local vendors, middlemen and transporters who collect drugs in bulk and distribute them across districts, informal street vendors, some of whom pose as pharmacists or health workers despite having no medical training, and desperate patients who often don't realize the drugs they're buying are past expiry, or know but take them anyway. On the regulatory side, the Uganda National Drug Authority, NDA, has attempted raids, arrests, and public awareness campaigns. But enforcement is difficult, especially when public officials themselves are sometimes implicated in the resale networks. Some vendors use irons or heat guns to fade expiration dates, then reprint new ones using inkjet labels, making expired drugs appear newly manufactured. Antibiotic resistance in Uganda is spiking, partly due to expired or substandard drugs that fail to kill bacteria completely, leading to stronger drug-resistant infections. Hospitals have reported phantom inventories, where records show full stockrooms, but shelves are empty, because the medication was siphoned off long before reaching patients. Uganda's expired drug market isn't just about broken systems, it's about survival. In a country where access to healthcare is unequal and medicine is scarce, even pills that are months or years past expiration still carry value. It's a system powered by desperation, corruption, and ingenuity. And while it saves lives in some cases, it risks countless more, quietly fueling antibiotic resistance, mistreatment, and long-term health damage. This is more than a counterfeit economy. It's a pharmaceutical grey zone, and it's growing. Subscribe to Weird Geo Economy for more real stories from the economic underground, where even expired medicine finds a buyer.